I met this woman once who had... She'd adopted 5 children that all had alcohol fetal... was it alcohol fetal syndrome. And they'd all come from the same mother. And so she'd continue drinking with each child was taken away. And it was just horrendous what these children were going... Each one of them had very different problems, but they were really extreme.
Absolutely. And one of the reasons this test case has come about is because the council who are looking after this child in foster care know that it's going to cost the British taxpayers £500,000.
That's the thing here. This case isn't actually about prosecuting the mother. This case is about criminal injury compensation, which, of course, is going to cost the taxpayer. And there's 80... other test cases, I believe, waiting on the outcome of this particular case. So surely, and we do need to differentiate here, I think, because we are talking about an alcoholic mother, and you blur the edges, and then we start saying, oh, well, you know, as an expectant mother, I think we feel guilty enough. So to feel demonised for having sort of one glass of wine at a party is
But I'm
wrong.
glad I feel guilty about what I drank. I wish I hadn't drunk what I drank when I was pregnant.
You're not...
No, but
this case
I wish the guidelines had been
alcoholic...
clearer, because we don't know.
This case is an alcoholic mother. She did it again with her second child. So with social workers, she was on the register to be as a matter of concern. And she'd been advised that her drinking could She said she'd given it up. She was drinking half a bottle of vodka a day. She was drinking 8 strong lagers. Now, is there a... First of all, I want to ask you, would you report one of your patients if you thought that they were drinking too much in pregnancy?
You know, that's a really interesting question. Medical confidentiality states that we shouldn't. That if a woman comes to me, she says, I'm pregnant, but I'm drinking, I'm addicted to alcohol, you know, do I go to the police? Of course I don't. I try and help her.
But it's weird, isn't it? Because that child is getting abused. I'm also physically abused,
exactly, and I'm also I'm looking after that unborn baby too. So it's a difficult question. But there's another question. If we start making it criminal to drink heavily in pregnancy, what about smokers? What about women who smoke? Because we know that is definitely...
And also, to make it criminal, you're saying that there comes a point where the fetus is an individual with rights.
Yes.
So where does that then leave the abortion law?
You know, it raises so many questions.
I mean, the thing is, if we
criminal
think back...
as well, you're making every woman out there ashamed of maybe having a glass of wine, or I mean, it's a fine line, isn't it? Of how do you make it criminal? How do you say no? Don't be ridiculous. You know, it's not that. I don't know.
I think that the problem as well comes that with this case in particular, you're having to prove that the woman didn't just act irresponsibly or recklessly, but that she deliberately set out to commit a crime. Because obviously, you know, we're talking about criminal compensation. How do you define that? Whether someone is just being reckless and irresponsible, or whether they're deliberately trying to harm an unborn child?
Well, I suppose that's a matter for the psychologists and the lawyers. But, you know, I would say that we've always had this expression, drink in moderation, for anybody, and it's especially true in early pregnancy. I mean, when you think an embryo starts from 2 cells, and if you're drinking and you know what the alcohol effect is on us, that you're subjecting that embryo to alcohol, a toxin. So it's the first 3 months which are critical, and I don't think most women, I'm sure, could do without, you know, drinking heavily for 3 months, or even in moderate, just drinking minimally for that period of time to ensure their baby has the best chance in life.
Hilary, thank you for talking us through all that. It's Hilary Jones, everyone. Thank you.